Is sciatica the same as slip disc? Most people think so that, but actually it is a myth. Let's explain the difference between a sciatica and a slip disc. In this video, I will explain the difference in a simple and easy to understand way. Let's start with sciatica. We all know that sciatica is not a disease. It is a symptom. It refers to pain that travels along the path of sciatica nerve, which run from the down back to the buttocks area and down back to the leg. Sciatica is usually affected one side of the body. The pain may be sharp, burning, or electric-like. And some people also experience numbness, tingling, or weakness in the leg. These are the symptoms of the sciatica. Now we talk about a slip disc. A slip disc is not slip disc, also called a herniated disc or a prolapse in the vertebral disc. Between the bones of your spine a soft disc is present. A cushion-like structure is present and that act as a shock absorber. When the outer layer of the disc is tear, the structures of the intervertebral disc, in the center there is a nuclear pulposus and the annular fibrosis. When the disc tear or the inner gel pushes out, that is the inner gel, and this structure is pushed out and putting the pressure on a nerve. That is called a herniated or a slip disc. This is a bulging disc that presses near by the nerve. So, in a simple way, the slip disc is a breakdown of the outer layer of the disc and the inner gel comes outside and compress the nerve that causes pain. What is a slip disc? How it put pressure on nerve and convert into a sciatica pain? Let's understand in a simple way. There is a diagram of a healthy disc. And we all know that disc act as a cushion between the vertebrae. The nerve has enough space and having no pressure. But in a herniated disc, there is a wear and tear on a disc, and the inner part of that disc pushes outward and put a pressure on a nerve that act as a compression. And due to the compression, putting a pressure on a nerve and that converted into pain, numbness, tickling, and weakness. And the pain travels throughout the pathway of the nerve and they remain also in back also. So key point is in the herniated disc can pressure on spinal nerve that causes sciatica, which is a pain that travels from low back of buttocks and downward to leg. So let's compare a difference between a sciatica and a slip disc. In a sciatica, it is a symptom, not a disease. We talked in previous session. But in sciatica, pain that radiating along with the path of the sciatic nerve. In lower back, first is initiated from a lower back, then it radiates into the buttocks area, back of the thigh, and radiating to the calf, and usually the foot part may be considered. The pain must be a sharp, shooting or burning like pain. Sometimes patients complain of a numbness, tingling, and weakness in a leg or a foot also. Sciatica is caused by a slip disc, spinal stenosis, piriformis syndrome, muscle spasm, or a pregnancy, tumor, or infection, and there are many causes that create a sciatica pain. But this condition is diagnosed by the clinical imaging, like MRI or X-ray. and treatment focus on pain relief and addressing underlying cause. And there are lots of effects that reduce the patient pain, like physiotherapy, exercises, stretches, medications, and surgical methods, and posture reproduction methods. But in sleep disc, you noted the many causes of sciatica, like a slip disc. Slip disc also a cause of sciatica. Not a herniated disc. It is a physical problem in a spine. Physical problem meaning there is a degeneration or a wear and tear of a disc, that is a disc damage, and occurs when the inner part of the disc pushes out through a tear and outer the wings, and putting the pressure on a nerve. So the symptoms of pain pattern may be a lower back pain, may or may not be a cause pain down the leg like a sciatica or not. Sometimes symptoms like dull, soft lower back pain may have in leg pain, numbness, tingling, weakness if nerve is compressed. But the cause of a herniated disc, it may be a trauma and or maybe age related. But the diagnosis confirmed by imaging MRI is a best test for diagnosing a slip disc, and treatment focus on a disc healing narrow, decompression and pain relief. There are a lot of medications, rest exercises and physiotherapy protocols, and one option also surgery in severe cases. So these are the basic difference between a sciatica and a slip disc. Sciatica, it is a symptom, but slip disc, it is a physical damage of a disc in a spine. I hope this video has helped you clearly understand the difference between a sciatica and a slip disc. If you found this video is useful, please like, share and subscribe to my division for simply evidence-based video anatomy and other education related videos. Thank you for watching. I will see you in next video. Thank you.